Hi everyone, this is the Queen of Back Pain Therapist in the whole of Africa. Today, I want to give you a tip, holistic tip on how you can stop stroke attack. Okay, so but before then, listen to this video to the end so that you can get the tip. The tip is coming with story, right? So I've been working on a client for years now, and he's geriatric client, which is old people. That's old elderlies, okay? So he's in his early 60s, and he's a pastor, and everybody, the protocols, the pastors, the wife, they know I'm his holistic therapist. I'm the one that offer massage, other therapies, linking with holistic. That's what I do for him, okay, for almost 5 years. One night around 2 a.m., pastor called me, 2 a.m. in the night, and he could not talk. He was wobbly, like, I said, "Are you okay? Is your wife there?" He said, "Yes." I said, "Give the phone to your wife." So he gave the phone to the wife. I asked her, "So what's the problem?" He said he stood up, went to the toilet to ease himself, and as he was coming back, he waved and was like this confusion. I said, "Okay, do you have a seat in your room that's executive chair where he can sit?" Say yes. I said, "Don't let him lie down." I said, "Take him to the seat. Let him sit from now till in the morning before you go to the hospital, and get ready. As soon as it's okay for you guys to move to the hospital, then you can go." You know, in Nigeria, Africa, you have to wait. If you go in the night, it's not all the hospital that you go in the night, they will attend to you. So I'm talking the story from Nigeria. Okay. So he the wife took him to the chair to sit down, and he sat there from 2 a.m. in the night till 5 o'clock. Okay, you know the reason why I asked him to sit on the seat for this long? Because I've worked on stroke clients or patient for the last 12 years. As a holistic therapist, I offer just therapy for them. I don't do any other thing. I major on therapies, on stroke, back pain, inflammation, and all that. So I I have asked people that have stroke over the years, for 12 years now, what happened before the stroke? Oh, some will say, "Oh, my face started dropping." Some of them will say, "Oh, I started having numbness on my leg and my hands." And some of them will say, "Suddenly headache." Some of them, "Oh, I've been treating malaria back and forth." And some of them, the one that actually struck me was the confusion. You know, some of them will say, "I just feel confused. I just feel confused." And so I have listened to stroke symptoms from patients, that's clients over the years, and it's the same thing that is written on the book. But I just want to know if people react different ways. It's just that they react in different ways, yes, but I just want to know if there are other new symptoms that we don't know about. It's still the same symptom, weakness of hands or feet. So then when I asked them, then what did you do when you feel this? A lot of them will say, "I went to bed." Some of them will say, "I woke up like this." Some of them will say, "Oh, I went to the hospital and they told me to lie down. And before they do one or two treatments, when I stood up, it's not because the treatment was not okay. I just find out that I'm already paralyzed." So I saw that when you have the symptom and you go to bed, you actually allowing that symptom to play its role. You align the stroke to play its role. So what you do, you don't sleep. You don't lie down for this stroke to attack you. You sit down and be aware of it. So this pastor sat down from 2 a.m. to 5 a.m. and I didn't call him back. I I told them to call me. So they called me around 5 and he was able to talk to me gradually, but he actually lost strength. He was very weak. So I asked the wife, I said, take him to the hospital. And how is he? He said he slept off in between because the woman could not sleep. She was just, putting eye on her husband. So he said the pastor slept off in between. And when he woke up, he asked Pastor, how are you? He said the symptom dropped, but he's feeling weak. So I told them to take him to the hospital. When they took him to the hospital, when he got there, when he started explaining to the doctor said, so I would ask you to sit down. The question came many times. Who asked you to sit down? Why did you sit down? So I don't know how he defend me through that question because I always tell them, don't tell them it's me. I'm not a doctor, I'm a holistic therapist. Don't tell them it's me. Because sometimes they'll like, oh, ask you before you know they'll start digging on me. And before you know, oh, she's not a doctor, she's not a physiotherapy, they will start problems. So I don't want that type of problem. So at the end of the day, this man just treated minor symptom in the hospital, and after he got himself, I did him lymphatic drainage, and till today he's okay. There's no deformity. He didn't get the symptom again. He's fine, doing well, and still my patient. Okay, so this is the way you can stop stroke attack. When you have stroke attack, I'm going to put it in a new video now. When you have stroke attack, don't sit down, don't lie down. Please sit down for a while. Let the symptom wear out while your eyes are open, while you are aware of yourself. Don't go and sleep. When you sleep, it will strike. Okay, so this is how you can stop stroke holistically. Thank you so much.